This is Taylor Birchie performing a demonstration for the new OB delivery record that we'll be doing in PDOC once CPN Gold goes live on February 23rd. The first demonstration I'll do is a patient after a vaginal delivery. I'm going to include a forceps assisted delivery as well as an example that includes a shoulder dystocia just to try to be as thorough as possible. And then I'll go through a simple vaginal delivery and a simple C-section as well. Before the simple vaginal delivery and the simple C-section, I'll also go over how to use the Cantex for the discharge summary on the patient's day of dismissal so that we can do away with the paper discharge summary that's currently in the chart that we all know and love. So to start off, I'm in my home screen. I click Find Patient. This is a test patient that we have set up, so we'll find that, go into the test patient. And again, so I will document, enter new. Again, this is after the completion of her delivery. I'll click on OB delivery note, which can be set up in your favorites. So here's the OB delivery note template. Again, this is what's going to take place of the delivery record that's currently in CPN that we fill out. This tab here is the nursing data tab. So any data that the nurse has entered in will flow in this area if you want to have this auto-populate for you. Most of the time the nurse is not going to have this data in at the time that you fill out this note, so I generally don't use it, but it's there if you'd like to. You can edit it if there is something that you'd like to change as well. So what I generally do, and again there's more than one way to skin a cat, but pre-delivery I'll go into newborn evaluation and say in this particular case we have a 30-year-old G2P1. She's at 37 weeks being induced for preeclampsia without severe features. Additional diagnoses include gestational diabetes, polyhydramnios. She was a forceps-assisted delivery that then suffered from a shoulder dystocia. Again, this is kind of complex just so we can kind of touch as many of the options as we can. And it'll also talk about laceration and episiotomy repair throughout this. So at delivery, say we ask the neonatologist and neonatal team to join. Again, you can pick any of these that apply. So estimated gestational age, so she was 37 weeks. If you'd like to get more detailed, you can come over to this down arrow and click. So say we can say she was 37 weeks in 1 day. Other current diagnoses, I generally free type this so we can do gestational diabetes and polyhydramnios. Okay. You can dictate whether or not they had steroids prior. This patient will know because it was not applicable in her case. You have to designate whether or not she delivered less than 35 weeks and why. So she did for a planned indicated delivery for preeclampsia. I encourage you to be as thorough as possible when filling out all of these areas. It will help with documentation across the board, both with the physician and nursing documentation. So some delivery information, delivery time. So say that the patient delivered 1650, alive born. Weight of baby, you can enter this if you have that information. I generally don't. Say we had a male. Apgar at 1 minute, 7, 5 minute, 9. Presentation, vertex, again, I encourage you to be thorough. And we'll say that this patient was OA. And you can enter any anomalies here that you may encounter during the delivery or with the baby. Cord blood gases, you can indicate whether or not you delivered, or collected, whether or not the baby had a nuchal cord, and any type of other cord abnormalities that you may encounter. I don't generally enter anything in additional comments, but you can if you want to type a brief note about the delivery or whatever. You can put that there. Baby B information, you'll do the same. Baby C information if you have twins or triplets. So in this case it was a vaginal delivery, so I'm going to go into the vaginal delivery tab here and say that it was an operative vaginal delivery. Anesthesia type, say the patient had an epidural. We did say we gave her a midline episiotomy. That was a 2nd degree. Lacerations, you can say yes, and there's no prompt currently to describe what type of laceration, so we can say that she had a right labial or any other type of laceration. Again, the degree of laceration when applicable, and whether or not it was repaired. So in this case, we'll say yes, it was repaired, but you have to we encourage you to enter the type of suture that you used. Again, this is a portion that goes into the delivery record on CPN that the nurses will have to fill out. So you can say yes, and then for additional text you can do, say, a 2-0 vicryl for episiotomy, and then maybe a 3-0 chromic for labial. So you'll go down EBL, enter the EBL, placenta, whether it delivered spontaneously or manually removed, mother's condition stable, infant's condition, and again you can elaborate if needed. Extraction details, this is more of the operative delivery stuff. So operative delivery was performed, yes, again we're going to do an example of a forceps delivery. The type, Close-Simpson forceps. Indications, you can check all that applies here. Patient counseling, any consenting that you did, you can enter in this area. Extraction assessment, again you want the cervix to be dilated, appropriate personnel notified, all that applies. Whether or not any rotation occurred. So fetal station, again, just clicking what applies. So total traction time in minutes, you can do the time that the forceps were applied, so, say 4 minutes. Number of pulls. I like to comment in here because it makes a little bit more sense to me to say 3 pulls, with 2 contraction, or however you like to annotate that. Again, pop-offs are not applicable with the forceps, vacuum detail not applicable, forceps detail. So again, this is just kind of going through your forceps information that was on the old delivery record. Okay. So once that's filled out, again, we'll use this example as a shoulder dystocia just for the sake of completeness. So we'll say yes, she got pulled into a shoulder dystocia. Initial traction on the shoulder, so the gentle downward traction with maternal pushing. So say the time the head was delivered, we'll say 16:45. The time that the body was delivered, 16:47. You want to indicate which shoulder was under the pubic bone. Whether or not fundal pressure was applied. So you can F2 through these and erase them. So no fundal pressure applied in this situation. And then you can go through your maneuvers. So, say we did McRoberts maneuver. Again, if you want to order the number of your maneuvers, you click the down arrow, performed first. Then say we went to suprapubic pressure, click the down arrow, perform second. And then say we did Rubens, or just however you decide to do it, perform third. Staff present, say in our case our in-house, we'll put that our staff was present, and any additional comments you want to add. Now what I've been doing with the additional comments for the type of delivery is I'll click into this box, and this is where I use my CanText to prepare for the discharge summary I'll do go into text, OB discharge summary, insert, and then you just kind of F2 through all of these. So admission date 1/1/6, F2 forceps assisted vaginal delivery, F2 male, and then again you can just F2 through all of these. I think we said the APGARs were 6 and 9 maybe, or something like that. Nuchal, none, spontaneous. And we're going to work on the formatting in this to make it a little bit easier to work with. So second degree appease, and right labial laceration prepared, mu times 1. You know, just you can fill out the information as it applies. Okay, so the final diagnosis, again, this is going to look like just like our paper discharge summary that we use now. So she was a, she had preeclampsia, gestational diabetes, shoulder dystocia, and procedures performed. So continuous external fetal monitoring, epidural, forceps assisted vaginal delivery, Roberts, suprapubic, reason for hospitalization, induction of labor for preeclampsia, consultants, and then these pertinent details that we enter. Okay, I'll add the EVL here towards the bottom of this too, just to kind of remind myself to include that on the discharge summary. Okay, so that template again, you go to text and you do the OB discharge summary. So that concludes the documentation for this particular delivery. So once my documentation is finished, submit, signed. Again, because I'm a resident, I have to have a attending, but you may not have to do this step. And then pin in my number to submit the note. So again, that's an example of how to do the delivery record just after the delivery. Again, I encourage you to be as thorough as possible to aid with documentation across the board. Now I'm going to go ahead and show you the discharge summary portion. So say that we are postpartum day 3, this patient's ready to go home, she's doing well, no postpartum complications. So what I generally do is go find the patient again, go in to document again, and I'll find my discharge, or not my, excuse me, I'll find my delivery note, the note that I just filled out. And I'll go down and I'll scroll down and I'll find that template that we use to enter all of that information. And I'll highlight that, I'll copy that, then I'll go to enter new, brief discharge summary without medrec, click OK. Discharge note. This has been pre-filled out because I've used this as a demonstration, but again, you can either go into free text or hospital course. If you go into free text, you paste what you just copied, and all of that information is there for you, all that meets the requirements of the discharge summary that we've been using. I'll add discharge date, so and then anything that might have happened in the postpartum course you can just type in at the bottom, and I'll put like routine postpartum course. And then there are 3 other criteria that you have to meet. So you want to do discharge to home, and go ahead and click home. You can add discharge diagnosis if you like to. Again, that's already on your template. Patient condition on discharge, stable. So make sure that that's clicked, or however it applies. And then I'll click on the discharge medications just to put that you've reviewed the med rec. And again, this is just a little extra, and I'll do the prescriptions just so I know that the prescriptions have been put on the chart. Click OK, submit that. And then you're done. That's your discharge note, your discharge summary to use on the day that the patient is dismissed. Pretty easy, pretty straightforward, and hopefully we can do away with that paper. Now I'm going to do an example of a patient who just came in labor, having a relatively uncomplicated vaginal delivery. 23-year-old G1 P0 at approximately 40 weeks of gestation. Again, I'm going to try and move a little faster this time, just so you kind of get a feel for how quick it can be. But again, enter new, OB delivery note. Again, I don't use the nursing data. If you want to add the days, any other current diagnosis that she may have. We'll just do a laceration with this. Second degree perineal. And you can put the degree here. Was it repaired? Yes. And with which suture? EBL. If it's a relatively uncomplicated delivery, you generally don't need to enter anything into the extraction details nor the soldier dyscotia. This is our discharge summary text entry here. So 2116. Whoops. So she came in labor, to term IUP, say she had meconium. Continuous external fetal monitoring, epidural. Labor. You could do, so say maybe she had an artificial rupture of membranes, an IUPC, if needed there, or pit augmentation, just whatever is applicable there. Alright, and that pretty much sums up a relatively simple vaginal delivery. You can go up again to the baby information. Our old delivery record didn't have, or excuse me, had a tab that was infant complications. This one doesn't necessarily prompt you for infant complications, so if you wanted to add meconium there, you sure could do that too. Sign it and submit. That didn't take me too long. This next will be a demonstration on how to use the delivery record to document with a C-section. You'll go into the same document, so again, enter new. OB delivery note. Again, you can use the nursing data if you choose to. Still fill out the pre-delivery information. And this would be an example of like a scheduled repeat C-section. Any other current diagnosis that they may have, so previous C-section times 1. Again, fill out all the pertinent information. Alright, so baby A, first status, live born. So once you fill out all the baby information, you're going to continue to go down to cesarean delivery. Primary indication, so in this case, we would say it'd be an elective repeat or breech malpresentation, whichever you would consider the primary. And again, there's several options there that you can use, and you can also free text in here. Priority, scheduled, so you have emergent, urgent, indicated. I believe this would be like an add-on non-emergency or non-urgent C-section, an elective repeat. VBAC, declined. Whether or not you gave antibiotics prior to the C-section, whether or not SCDs were applied, the type of incision you did on the uterus, and talks a little bit about consent of the patient, mother's condition after the surgery, infant's condition after the surgery. And again, under the additional comments, this is where I add my text. Again, this is probably a little bit redundant initially, but it serves its purpose when you get to the discharge summary for the day of dismissal. You can F2 through all of these brackets. On the C-section, I'll add the EBL, IV fluids, and urine output. The nice thing about this note is that they've tacked on the op note on the end of this, so you can continue down to the operative note, and this will serve as basically the procedure note after the C-section that we currently do separately. So repeat low transverse C-section, surgeon. You can enter in assistance, and this is pretty similar to the note that we have currently that we do for a post-procedure note. And then it has a place if you want to add your dictation number at the end, you can do so. And then submit that. So this serves as your delivery record and your op note all in one place. And that's really the conclusion of the cesarean section portion. Again, if you decide just to review the discharge summary, so say that same patient, we're at post-op day 2, and they're ready for dismissal. I would go into their chart, go to their delivery note, copy and paste this portion that we entered in here. And that's also formatted, so with the vaginal delivery, you can use that as the quick clinical note for a vaginal delivery. This same format here. Again, enter new, brief discharge without medrec, and then go to the discharge note. Again, discharge to home, hospital course. This will not be there on a new note. Paste that information, edit it as necessary. Again, I add the discharge date. And any pertinent post-operative complications that may occur, or if they have routine post-op care. Again, you'll need to comment on the patient's condition at dismissal, so stable. Whether or not prescriptions, again, this is not required, but whether or not you want to review the medications, indicate that you reviewed the medications, and make a comment about the prescriptions. Again, hit submit, and that is your brief discharge note for the patient on the day of dismissal.